Hemoptysis is the coughing up and expulsion of blood from the subglottic airways through the mouth. It must be differentiated from other medical conditions such as hematemesis or blood vomited while vomiting, swallowed epistaxis or nasal bleeding swallowed, and gingivorrhagia or blood coming from the gums. The volume involved determines the severity of hemoptysis, with more than 500 cc considered to be a serious prognosis. There are several criteria must be evaluated while examining a patient with hemoptysis, including the hemodynamic condition, respiratory status, searching for acute respiratory distress, and neurological state based on the Glasgow Coma Scale score. After the patient has been stabilized, an etiological examination should be performed. The patient's medical history, including any pulmonary or cardiac issues, as well as any history of smoking or drug use. Trauma such as chest puncture or drainage should also be taken into account. The impact of hemoptysis is explored by physical examination, focusing on the respiratory or cardiovascular indicators, along with an extra-thoracic indications or general symptoms. Radiological examinations play an important role in determining the cause of hemoptysis. An X-ray of the chest may show direct indicators such as bronchodilation or indirect symptoms, for example, atelectasis. Bronchoscopy is performed to confirm the diagnosis, locate the source of the bleeding, and collect samples. Chest CT is more sensitive than chest X-ray and can detect vascular abnormalities as well as offer information about the bleeding lesion. Cardiac evaluation and lung scintigraphy may also be carried out. In the diagnosis workup, laboratory tests consisting of a complete blood count, coagulation profile, blood grouping, and blood gas analysis, as well as D-dimers and bacteriological investigations are also useful to determine the causes. The main causes of hemoptysis are bronchopulmonary. This includes pulmonary tuberculosis, lung cancer, bronchial dilatation, and pneumonia. Cardiovascular diseases can also be a cause. This includes valvulopathy like mitral stenosis, pulmonary embolism, and vascular malformations. In some cases can be the use of anticoagulants, a recent pleural puncture, or bronchial biopsy. And lastly, in some cases, no cause can be identified. The treatment largely depends on the quantity of the bleed. The objectives for low or moderate hemoptysis are to reduce anxiety and coughing, as well as stop the bleeding with hemostatic procedures. In severe hemoptysis, the patient is entered into an intensive care unit, alongside with medical and endoscopic treatments, which are often necessary. Bronchial embolization may be used until surgery is possible. Thanks for watching.